pure inversion, eversion or inversion, or supination or pronation. So we talk about the overall motion of pronation and supination. So pronation is going to have dorsiflexion, adduction, and eversion. What am I doing? This pronation. So flattening your arches. Okay. So go ahead and stand up. Slip your shoes off. Some of you, this is going to be easier than others. I think you and I might have a competition on flat feet. Is that true? Yeah. Yeah. So if you intentionally bring your knees together and go down, that's going to be pronation. Now try to make your arches higher. Roll out on the outside of your feet, keeping your toesers down. That's going to be supination. That's very hard for me to do, is to get into supination, but boy, you ask me to flatten, I can just flatten with the best of them. So we're going to be looking at the combined motions of those two major motions. Okay. So we're going to start with plantar flexion and dorsiflexion. So I just need a warm body up here. We'll do goniometry. Come on up. Thank you. I'm going to have you lie on your back. And this under both of your legs. So you could throw your undergrad here or all your undergrad here?
All my undergrad students.
So you just do like the extra class?
Yeah, this is fine.
That's what I thought.
Oh, I cannot wait to find out.
Alright, so if we're measuring joint angles of the ankle, we need to have the knee bent. Why?
The muscles that cross.
Right. So the gastroc is going to be lengthened with knee extension, and we don't want it to be lengthened. We don't want it to be our limiting factor here. Okay? Actually, Mike, I'm going to scoot you down so that you can hang off the edge. There you go. You all are very professional scooters. And look, I'm going to take that.
This one was a good scooter before, too, I remember.
Okay.
Yeah, girl.
So you have to have the knee bent. And it needs to be bent so that the knee is more than just 10 degrees flexed. It needs to be flexed more than that. So these work very well for that. For those of you who haven't used these before, as some of you haven't because they're dusty, the short end usually goes towards the thigh and the long end goes towards the feet. Okay? It depends completely on leg length. You may have to flip it, but typically the short end goes north. Now, for ankle plantar and dorsiflexion, again, the slides are going to be very careful about saying what component those two are. For the rest of today's talk, I will talk about pronation, supination, inversion, eversion, plantar flexion, and dorsiflexion like they are their own thing. Just know that they're not, that we're getting combined movements with all of these. So here we're going to line up the stationary arm along the tibia and fibula. We're going to use the fibular head as our landmark. The moving arm is going to be the fifth metatarsal. And that's super important to remember because you have this big, fat, bony knob right in front of your face. You're going to want to put the axis on it, and that's not the right place. So if you remember that the moving arm has to line up with the fifth metatarsal, you won't be able to put this where it looks like it should go. Okay? So what you want to do is line up just checking on me. So the axis is going to go in line with the fifth metatarsal, not on the big bump. I'm trying to not say it because I don't want to put that in your head.
It says in the notes the axis is on the lateral mound.
No, it doesn't. It says it's distal to the lateral.
Oh, just okay. I see.
I guarantee you it doesn't say that. So, so it's going to be in line with it because we're traveling up the fibula, but it will not be on it. Okay? So in this position, for passive, I would come up, I would feel end feel. And then I'm going to get a measurement. Go ahead and lash your foot for me. So he's at 0 to 14 degrees of dorsiflexion. Are you a toe runner or a midfoot striker?
I'm a midfoot striker, yeah.
Nice. Do you run barefoot?
No, I'm a striker.
Now I'm going to bring your toe down. I clearly am not a part of some joke.
No, you can just make yourself part of it.
Yeah.
I don't think there's anything secret about it.
Just doing a nice job.
10, 20, 30. So he has 36 degrees of ankle plantar flexion.
I don't think so.
Okay. Now for this one, the vast majority of people will be able to get to neutral because you need to be in neutral to stand if you don't have on shoes. Okay? So it's highly unusual that someone can't get to zero or that anatomically neutral position. That said, if you have someone who walks around in Erica's shoes all the time, no, your fancy shoes.
Yeah.
Your Sperry's.
Those people may tend to not walk barefoot much, and so they may have some tightness. But generally, most people can get to 90 degrees, which is going to be our zero position because this is anatomical neutral here. Okay? Go ahead, Alex, again. Now, one of the slides, the next slide about dorsiflexion is talking about subtalar neutral. Okay? And what you're going to do is you're going to take your thumb and your index finger and you're going to go over the head and neck of the talus. Your thumb is going to be in the sinus tarsi. You remember those words from yesterday? And what you're going to do is then grab the calcaneus and you're going to move the foot. Mike does not have a lot of rear foot motion until your pressure is equal in both hands. You won't know what that means until you feel a foot. Okay? Now, if you push really hard with both hands, they're going to feel like it's in the right place because you're feeling the bone on both sides. So just gently put it there. Move the talus or the calcaneus. The talus will move with it, and feel how that pops into your hand on both sides. And you want that to feel symmetrical. For some of you, your subtalar neutral is going to be really wonky, like a lot of inversion. Very few of you will be a little bit in eversion. Okay. But what you'll do is palpate that, then I'm going to switch over, and now I'm going to bring him into dorsiflexion while maintaining that subneutral position. And now I would take this measurement. Subtalar neutral is important if you are going to create foot orthotics, and that is within the scope of physical therapy practice. You want to know how much available range of motion the foot is in. The foot has when you have them in supposedly the optimal position of the talus, okay? Because then what you would do is build up the orthotic to get that optimal foot position to meet the ground. Okay? How many of you have had foot orthotics made? A few.
I have a question. So if we got that on the exam, would it just say dorsiflexion, or would we specifically say like in subtalar neutral?
So both of those are on. So one person will get just dorsiflexion, and someone else is going to get dorsiflexion and subtalar neutral.
And if you just get dorsiflexion, you don't put them in neutral, you just let them do
Exactly.
whatever they want.
Yeah. And the vast majority of the time, that's what you'll do clinically, is just measure it without worrying about subtalar neutral. Sarah?
You said when you're feeling for neutral, one is in the sinus and where is the other one?
You're right on the head and the neck of the talus, so you're going to be anterior to the medial and lateral malalia on both sides. Okay. I'd like to go ahead and show you two more measurements because you're going to do them with the person in the same position. Okay. Does someone have their medium-sized goniometer that I could borrow? It's going to be faster. Oh, I think James is going to win. Oh, thank you. You'll let him win? Sure. So for inversion and eversion, we're going to have two different ways to do that measurement. One is going to be whole foot inversion and eversion, and the other one is going to be subtalar inversion and eversion. So if you're needing to measure the whole foot, you're going to do it from the anterior side. You're going to put the stationary arm right along that anterior ridge of the tibia. The stationary arm, the moving arm is going to line up right alongside the second metatarsal. The axis is going to be in that mortise. Okay, so a spot right in between the medial and lateral malleoli, or malleoli. I cannot say it that way. Okay. So now for supination, I'm going to take his foot and I'm going to grab his forefoot and I'm holding the goniometer down and I'm going to pull his foot up. And Mike has pretty rigid feet. Okay, so he's at 0 to 25. Now I'm going to switch my placement over to the other way. We're going to get back into his straight. And now I'm going to supinate. I'm going to pronate him. And now I'm getting 15 degrees. Okay? But the alignment is the same. The anterior aspect of the tibia, the second ray, the axis is going to be right between the malleoli. This one, you can also measure active range of motion as well. So can you turn the inside of your foot towards your other foot? There you go. Good. And he has even less. Go ahead and relax. Now bring this side of your foot out towards, there you go. You're such a good patient. Okay, so, and relax. So he has even less active range of motion than passive range of motion, which is interesting, because his foot's pretty rigid. Okay? Any questions about that? You need to use the flexible goniometer because this one you're not going to get to line up, correct? Okay, so it might actually work. It might be curved the right way. So you do need the flexible gonies because it is going to be like that. All right. So we talked about plantar flexion and dorsiflexion, dorsiflexion and subtalar neutral, and pronation and supination for whole foot pronation and supination. Okay? All right.